to you, madam.
Yes, Sunil. I just have a small presentation which I'll share. So as Sunil mentioned, our, am I audible? Sunil, I'm audible, no?
Yes, ma'am, you are audible.
Okay. So, sir and dear colleagues, as Sunil mentioned, our post-budget webinar focused on two budget announcements. One is relating to medical education and the other to cancer care. Our introductory session was spearheaded by Dr. V.K. Paul, who is member health of NITI Aayog. And in this session, he basically explained how in the progress over the last decade, we have laid a strong foundation for this year's budget announcements, both in the sphere of medical education as well as in the sphere of cancer care. So as Sunil mentioned, the first budget announcements relates to setting up of 10,000 additional seats this year in medical colleges as well as hospitals. And this is to achieve the goal of adding 75,000 seats in the next 5 years, which the Honorable Prime Minister had said in his speech on 15th August 2024. The challenges that were identified during the webinar primarily related to the shortage of qualified faculty and specialists, to affordability and accessibility of medical education, availability of adequate clinical resources as well as infrastructure, and it also spoke that there are limited opportunities for specialization, which leads us to a vicious cycle of not having adequate faculty. Next. Then we have tried to categorize the recommendations that came during the webinar into these broad categories. So as far as the faculty development and shortages were concerned, our experts who ranged from private colleges to government colleges to the regulators and very esteemed faculty were there in the whole session, which was managed by Director Ames. In that, the experts basically stated that we need to assess our faculty gap and ensure that the recruitment that we do aligns with the increase in medical seats which we are planning. So they thought of ways to expand the pool of faculty. They came up with a suggestion that maybe we can share faculties between medical colleges, especially with regard to non-clinical subjects. They also spoke of leveraging technology for teaching. Honorable PM also today in his address spoke of using technology for education. So this was a suggestion which came forward from our experts also. There was talk of strengthening of the faculty development programs so that our faculty can keep in tune with the emerging medical education, and this would bring in better remuneration and career progression for them also. So there was talk about flexibility in entry as well as in faculty norms. And in order to encourage research, they said that there should be adequate time available for research also to our faculty. And they spoke of having perhaps separate recruitment boards in states for faculty. Regarding curriculum, there was stress on competency-based medical education and bringing in early clinical exposure for our students. They also emphasized that the communication skills of our students and faculty has to increase. So bringing in soft skills into the modules, research skills, and we should not just emphasize the curative aspects, but also the preventive and promotive aspects relating to health. A lot was spoken on integrating AI, telemedicine, digital health into the syllabus, and there was talk of centralized digital libraries, tele-learning platforms, and simulation labs. A very important point which emerged from the entire discussion was that we need to optimize our existing resources, because that is the only way we can tackle the issue of resource crunch, both in clinical as well as infrastructure resources. It was said that we have district hospitals, we have smaller hospitals, we have hospitals belonging to public sector units, central government hospitals, we have the private hospitals. So how can all of these be utilized for medical education was discussed, and bringing in public-private partnerships to enhance medical education was also touched upon. Then regarding PG seats, it was strongly felt that we need to increase PG seats, and this could be done by leveraging some of these hospitals for bringing in standalone PG institutions. These hospitals could be of health ministry, they could be of the other ministries, they could be of ESIC and our various other PSUs. These could be private institutions. Another feedback which came from the state secretary was that we should implement the district residency program. Not only does it brings in clinical exposure to our students, but it will also help us bring in additional 25% seats. This came as a very good suggestion. Regarding affordability, there was talk that the regulation of fee structure should be done in a very fair and transparent manner. And we have to see how can we bring in more low-interest student loans as well as expand scholarship where required with the help of CSR. Based on these recommendations, a very tentative implementation plan has been drawn up. How states, during which timelines should states map the existing seats in their medical colleges? What is the possibility of expansion? Where can we start DNB courses, especially in private hospitals? Where other ministries can identify their potential hospitals where we can start PG institutes, a stakeholder consultation to meet the faculty requirements as well as faculty development, how to strengthen competency-based medical education. We decided to set up a core committee which would look into integration of AI, digital technology, and research in medical education. So these were some of the points and we tried to draw up an implementation plan for ourselves. The next budget announcement deals with setting up of daycare centers in all district hospitals in the next 3 years and 200 centers this year itself. For this webinar also, we had experts from every tier of cancer care, as well as those who are working with patient support groups. We also had people from the NABH, from other foundations who are working in cancer care. The challenges which were identified during the webinar, of course, relate to manpower shortages because this is a very specialized field. There was emphasis on the training needs, the equipment and infrastructure, if it has to be brought in district hospitals, how to go about it, how to manage the drugs, because there would be requirement of specialized drugs for every type of cancer, and the talk of referral systems, because as Dr. Paul had also mentioned in the morning, at primary healthcare level, we are doing screening for 3 types of cancer, how to link it to our district hospitals, then to the state cancer institutes and other tertiary care institutes. So the recommendations was that we need to ASAP do a gap analysis of all our district hospitals. The training programs have to be very comprehensive. Luckily, in our expert group, we had people who have developed such daycare centers. So they had a lot of suggestions to offer to us how standardized training modules can be developed, how do we train the existing staff and local doctors, and also ensure the availability of these trained doctors in the district hospitals. Honorable PM spoke in the morning about daycare centers and digital health infrastructure, linking the two. So this will, of course, prove very powerful because we are dealing with the poor population, which may also be migrant population. So we need to track them. So as another colleague spoke, it is very important to implement the Ayushman Bharat digital mission fully, and having broadband connectivity to our PHCs will help, because that is where the ABDM registration starts in most cases. There was also the talk of the importance of patient support groups in hand-holding the patients, because most of these daycare centers are going to look at chemotherapy. So that requires a lot of support from people. There were suggestions relating to equipment, infrastructure, how you do the drug management. It was emphasized that you need online platforms to do it. So we have a DVDMS platform which we will have to leverage for the purpose. How to maintain the equipment that we bring was also discussed, and how to handle the logistics of the drug supply. So that's why this recommendation for strengthening regional drug warehouses. The referral linkages, as I mentioned earlier, become very important because this is going to be a hub and spoke model. So the district hospitals with tertiary centers on one hand and the Ayushman Arogya Mandirs on the other hand. The entire cancer care works on SOPs. So we need to have clear protocols for the referral systems, as well as the use of the digital health infrastructure to implement these protocols, and training in these protocols for all the people involved right from the beginning. There was talk of affordability and accessibility. A number of suggestions came that the cancer patient transport becomes very important. And for this, we also thought we could leverage public-private partnership. Community engagement becomes very important in cancer care. Here also, we tried to develop a broad implementation plan. Gap analysis of the facilities at our district hospitals, including the existing daycare centers, is very important. We have to work out a strategy for infrastructure development in a time-bound manner. The HRD part, which we spoke, we need to train staff in these specialized protocols. So this was our broad strategy, and I wish all of you good health. Thank you.
Thank you, madam. Now, to sum up the breakaway session on strengthening urban livelihood and PM Swanidhi, I request Ms. Sophia Dahia, Chief Controller of Accounts, Ministry of Housing and Urban Affairs. I'll request, in interest of time, to be a bit brief in summing up the breakaway session. Over to you,
Thank you.
madam.
Thank you. Namaskar to honorable ministers, respective secretaries to Government of India and colleagues. I am representing Ministry of Housing and Urban Affairs. As we speak, an international conference is going on in Jaipur on circular economy, and Secretary Mahua and Honorable Minister are participating in that as we speak, and that is an international conference. So I've been asked to some of the two breakaway sessions for the ministry. In line with the words of